Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elisa Minkin. I am a general pediatrician and proud JOMA member, and I'm really honored and really excited to be here today with Motty Grunwald. Hi.
Hi.
Thank you so much for doing this with me.
My pleasure.
Motty Grunwald, CCC-SLP, BCS-F, and you will let us know what those mean in a minute, earned his master's in speech and language pathology at the Long Island University in 2003, graduating magna cum laude. He externed at the Manhattan Eye, Ear, and Throat Hospital, where he worked extensively with patients with voice disorders. He then worked as a speech therapist in several clinic and school settings with children and adults with various speech and language disorders. Eventually, he decided to pursue board certification in fluency disorders. He was mentored for 4 years by Walter Manning, author of the textbook Clinical Decision-Making in Fluency Disorders, associate editor of the Journal of Fluency Disorders, and at the time, associate dean of the University of Memphis. Motty is licensed as a speech-language pathologist in New York and New Jersey. He also holds a certificate of clinical competence in speech-language pathology, awarded by the American Speech, Language, and Hearing Association, and he is one of the fewer than 0.1% of speech therapists in the US that is also a board certified specialist in fluency disorders, awarded by the American Board of Fluency and Fluency Disorders. Wow. He currently works at Ezra Medical Center in Brooklyn, New York. So thank you so much for doing this with me. I am really honored to have this rare bird called a fluency specialist here.
Pleasure to be here.
Yes, I mean, you're very unusual, and so you can really give us an insight into stuttering, which is not an uncommon problem. I'm gonna let you just go right in and tell us what is stuttering, how common it is.
Okay. So before we even discuss what stuttering is, let's first go a step back and say,
Okay,
what's fluency?
got it.
So fluency, we call it fluency disorders, is comprised of two things. One is stuttering, the more famous one, and the other one is cluttering, which I'll talk about soon. Now, we're more familiar with stuttering, so let's discuss what stuttering is. So as opposed to, let's say, articulation, where articulation is considered the problem, and then you have underneath that different issues. So you can have, for example, a child who had a lisp, or somebody who can't say a certain sound. So those are different problems within articulation. In stuttering, they're both the same thing. So the stuttering is the problem, and stuttering is what people do, but they're not really the same. Because when we're talking about stuttering, person who stutters, we're talking about certain things the person does.
Mm.
So when we say stuttering, people think of the disfluencies, as we call them.
Mm.
So disfluency is like a disruption in speech. When we talk, everybody has disfluencies. We call them normal disfluencies. Anybody who talks puts in interjections. We say or like. We repeat words many times, repeat phrases. It's basically stalls for time. It's a language thing that we stalling and we're thinking we want to say. Those are normal. Those are not stuttering. But then we have those disruptions or disfluencies that we call stuttering, and they are totally different. They are, so you have those that are word repetitions, not words that we non-stutterers do. We will do something like because, but they will do what we call a monosyllabic word repetition. So it'll be but. They'll do sound repetitions, la, like, or prolongations we call like. Things like that are not what we call normal disfluencies, and they are what we call stuttering. And also people who stutter usually have many more of the normal disfluencies in their speech. So the person who stutters has disfluencies that are quantitatively and qualitatively different than somebody who's what we call a fluent speaker. But that's actually only the stuttering, the observable stuff that we can see and actually hear. We can hear them. But then there's other things that are going on, and we call them secondary behaviors. And the secondary behaviors are, we divide them into avoidance behaviors and escape behaviors. The escape behaviors, we'll talk about those first. That's what people do when they're stuttering because they want to get out of the stutter. So an escape behavior will be something like a head tilt or eye blinking or hand movements or things like that. You actually see them do it. An avoidance behavior is what somebody does to avoid the stutter. And that's sometimes harder to tell. So that will be sometimes something like a word substitution. When they see that as a word coming up and they're afraid of that word, they'll substitute it. Or they're afraid of a certain sound, they'll substitute that. Or sometimes they'll do something we call circumlocution. They'll change the whole sentence because they're afraid of a certain word. And sometimes they'll avoid a certain situation. They won't go to an event because they're afraid of that event, because they're afraid they're going to have to talk over there. So there are the disfluencies, which talked about before, and then we have the secondary behaviors, which we divide into avoidance and escape behaviors. But those are, again, part of the stuttering itself.
Mhm.
But that is not the stuttering problem, because there are people who stutter quite significantly, and they're not really bothered by it. So are we going to tell that person you have a problem and you need therapy? Well, no, because he doesn't care. So that's not a problem for that person. And there are other people who stutter very mildly, but to them, it's the end of the world. So again, we're not going to tell that person, well, according to the numbers, you don't stutter enough, so you don't need therapy. Well, to this person, he stutters terribly and it's affecting his life, so he needs therapy. So that's where the stuttering problem comes in.
Mhm.
So what is stuttering? Well, stuttering is stuttering itself, the disfluencies and the secondary behaviors. But more importantly, it's the stuttering problem. Is there a problem? Is the stuttering affecting this person's life? If the answer is yes, well, the person has a stuttering issue. The answer is no, well, who am I to tell them that the person
Exactly.
has a problem?
Right. And I also want you to describe the word cluttering, which you had mentioned to me. I had never heard it before.
Okay, so cluttering is totally different than stuttering. It's I think a fascinating thing, because yeah, it's multifaceted, and we're not even sure exactly how to diagnose it. What exactly does a person have to do to be called a clutterer? It's still, the literature is still not sure about that, but we're still coming to a conclusion. Today, it's believed that a person who clutters has to have fast or irregular speech. That's number one. And in addition to that, they also have to collapse syllables. So for example, the word refrigerator will come out refrigerator, or they'll just drop certain sounds or syllables. Many times people who clutter have language issues, um, word finding issues, sometimes narrative problems, and we call them, they have maze behaviors. So they'll start talking to you, they'll stop, say a different part of the story, and then start, and it's like, whoa, what are you trying to say? We're not talking that he's not intelligible. Let's say the person is intelligible. We don't understand the language content. So a clutterer presents many times with different problems. It sometimes looks like it's a clarity issue. It sometimes looks like it's a language issue. And it sometimes looks like it's stuttering.
Now, what causes that? Is that like a kind of aphasia?
No, it's not aphasia. It's a fluency disorder. We're not exactly sure what the cause is. And what's even trickier is that many times cluttering and stuttering co-occur. So many times people come to me and they've been to other therapists, and one therapist said, well, you have a clarity issue. And one said, you have a language issue. And one said, you have a stuttering issue. And well, it's cluttering. It's all one big thing,
Is
but it's
cluttering
totally different.
sometimes, I'm sorry, is cluttering sometimes seen in a stutterer who's trying to kind of hide it?
No,
No.
no.
Very interesting.
Yes, cluttering is very fascinating.
Let's go back
And
to, is it common though? Because I mean, I've never heard of it before you mentioned it.
it's more common than you think, yes. And one more thing about cluttering is that usually there's a very big lack of awareness.
Right.
The person itself, himself, as opposed to a stutterer, who is usually very aware of what they're doing, a clutterer oftentimes has no clue. And they are positive that the problem is with the listener and not with themselves.
Oh, they don't realize they're not so
No,
intelligible.
usually they are totally oblivious.
But it's not a language disorder, because like in aphasia, that might happen. I mean, it's a word salad in the more extreme example, right? And
Like it's not aphasia, but sometimes there is a language component to it, yes.
so maybe because they have an underlying language disorder, they don't understand that they're not using
No,
language.
it's just a lack of awareness. Even the clarity issue, they they can swear that they are intelligible. They'll say, what I just said, yeah, anybody understands that. So it's fascinating. It is.
Wow. Wow. So stuttering is common. I mean, cluttering, you're saying it's more common than we know, but stuttering is pretty common. Can you tell
So
us
about 1% of the population
Right.
stutters, in the adult population. In children, it's much more common.
Right. I want to go to children because I'm a pediatrician and this is my comfort zone.
Right. Okay. Fine.
But this is what I have to deal with. What percent of children will have what's called developmental disfluency or just normal stage where they stutter? And what
Okay.
is that?
So most children, some will say virtually all children, go through periods of disfluent speech. But the disfluent speech of most preschoolers, and when I say children right now, I'm talking about preschoolers. Most preschoolers, the disfluent speech are normal disfluencies. We talked about before, word repetitions, phrase repetitions, interjections, the ums, the buts, but those are normal. About 5 to 8% of preschoolers do have what we call stuttering. Of those 5 to 8%, most of them have what we call spontaneous recovery.
Mm.
It goes away in about 75 to 80%. There are different data, but it's about 75 to 80%. Now, when we say 75 to 80%, we mean from the time of onset. So if a child starts stuttering when he's 36 months old, there's a 75 to 80% chance that he will have spontaneous recovery. But as time goes by, the numbers go down. So after a year, the percentage that he's going to spontaneously recover is much less.
Right. So I'm a preventative type of person, of professional, and I would want to know when to refer, because if you're saying 75 to 80% outgrow, you might say watch and wait, but we know that early intervention makes a big difference.
Right.
So that 36-month-old, how do you know when to refer?
Okay, so that's a very good question. And we nobody can tell you for sure which children are the ones that are going to stutter into adulthood and which ones are going to spontaneously recover. But we do know that there are certain red flags.
Mm.
So, for example, if there's a history of stuttering in the family, that's a red flag. If it's a male, that's a red flag. Many more males than females stutter.
I think it's 5 to 1, right? 5 to 1. Yeah.
A ratio about 4 or 5 to 1. Yeah.
Mm.
But when they're preschoolers, it's more 2 to 1, or maybe even about the same.
Because it's normal to have that phase.
Yes. Well, I'm not sure what you mean by normal. What do you mean by normal?
I mean, it's normal, like you said before, for children as they're learning to speak to not be fluent at first. And
Right.
There'll be a whole spectrum. I guess we're talking at this point of where it really looks more like a stutter as opposed to a, like kind of interjection or.
Okay. So yeah. So it's very common for preschoolers to go through a period of stuttering.
Right.
Yeah. But when to refer is if there's a history of stuttering in the family, if it's a male, if he's doing secondary behaviors, in other words, moving his head or blinking his eyes, or he doesn't want to talk, or if the parents are overly concerned, then usually a referral is a good idea. But I think most therapists would say to wait about 3 months before getting in touch with the therapist, because the first 3 months really you can wait, unless the child is already about 5 years old. When the child reaches 5, then maybe you shouldn't wait that long. But
if the child is distressed by it, the degree of the child's distress would also make me. I've referred kids who are very young in those scenarios.
Yeah, so the child is distressed by it, yes, for sure. But if the child doesn't seem distressed and the parent doesn't seem distressed, and the child is barely 3 years old, no history of stuttering in the family, then if it's just really close to time of onset, we'll probably say, let's take a wait and see approach. But it depends. It depends on a lot of different factors. We can't say for sure. But we do know a lot more today than we knew even only 50 years ago, even only 25 years ago. And we will advise therapy much sooner than we did 25 years ago, or even 10 years ago.
Right. Can you talk a little bit about why it's important to get that? Because, a lot of parents with any problem want to wait and see. they may want to wait and see more than say I do as a pediatrician.
Okay, so the longer you wait, the more of a chance there is that the child is going to start feeling embarrassed and ashamed about it, and start wanting to talk. And once you start going into that direction, and even when the child goes into therapy, it's going to be harder to deal with in the therapy. Now, if the child eventually outgrows the stuttering, well, it doesn't really matter. But if the child persists in stuttering, then the sooner you deal with those negative emotions, the better. You don't want the child to have these negative emotions and carry along with them the rest of their lives. If you can help the child as soon as possible deal with those emotions, it's always better.
Right. So you're talking about emotions. So I have to ask the question. I think a lot of people think people stutter because they're nervous.
Okay. So that's a very common misconception. No, stuttering seems to be neurological. There's evidence that it's neurological. There's more right hemisphere dominance than left hemisphere in people who stutter. There's a strong genetic factor. And it seems that environment and language play a role in it. What was the question? I'm sorry.
Oh, we're talking about it's not an emotional disorder. People
All right, okay,
see somebody
right.
with a stutter
So we
looking
know-
nervous
so
and
we-
think,
okay,
oh,
I'm
they're just
sorry.
not nervous. They wouldn't stutter. You
I'm
just
sorry,
calm down. It's okay.
I'm sorry, I forgot. Okay,
Yeah.
so
It's okay.
it's neurological. It's not anxiety. It doesn't come from anxiety, but somebody who is nervous does develop anxieties because, well, people who listen to them don't have patience and sometimes just walk away or cut them off or finish their words or finish their sentences, or just sometimes laugh outright. And in school, many times they're bullied.
Yeah.
So it becomes an anxiety issue. So again, stuttering is not caused by an anxiety issue, but because they're stuttering, they start developing anxieties.
That's a really good point. And I'm going to go back to what you said earlier. Something interesting you said is that there are some people who have quite poor fluency, like a quite obvious stutter, and it doesn't bother them. And there are some people who have very mild stutters and they're tremendously upset by it. So it's just something to think about whenever you have any condition to normalize it, to, if it's your child, I'm talking as a pediatrician here, to support your child with being who they are. And it's okay. We all have struggles. We all have things that is hard for us, to help them with the emotional component of stuttering. It doesn't need to be a bigger deal than it is. I mean, I'm thinking of tic disorders, which is a related neurologic disorder. And when children have them, there's some people who say, stop doing that, and they put pressure and then they're anxious and they have more of it. It's kind of, in my mind, a parallel. And one of the best ways you can help as a parent is to say, it's okay. Some people have these, it's not your fault. It's okay. And that can bring down the stress on the child, which can help just by reassuring the child. It's not therapy.
That's true. So many parents are under the impression that it's not a good idea to talk to children about stuttering. So we don't talk about that. But we know from talking to adults who stutter, and we ask them, tell us, what was the thing that when you were growing up bothered you the most? And by and large, most of them said the fact that nobody talked about it. It was taboo. Now, kids aren't stupid. If the child is stuttering, he knows he's stuttering. So why not just acknowledge it? So we tell parents, just tell the child, oh, you had a hard time talking. Oh, lots of kids your age have a hard time talking. Remember when you were walking, you sometimes fell down, and then you got up and you walked, and you learned the same thing is with talking. But somehow parents got the idea that you're not allowed to do that. But not talking about it is in a way much worse than actually acknowledging it in a very caring manner.
Right, but moving on also, because I'm going back to the tics, like if your child has tics, you certainly should talk about it and tell them about it, but then you don't have to keep pointing it out or even saying, oh, you're not having so many tics today, because I think drawing attention to it unnecessarily is not helpful.
Well, I'm not saying we should draw attention unnecessarily, but when a child is stuttering severely and can't get his word out, not to say anything is not a good idea. That's when it's warranted to say something and put the child at ease.
Right. The reason I'm saying that is because I was reading or listening to some people who have a stutter talk, and they were saying they didn't like it when people were saying, "Oh, you're having a good time today. You're really speaking clearly." Like they didn't like that focus on the speech. It's kind of like when someone, is dieting. "Oh, you look so great. You must have lost weight." Like, don't focus on the problem. You can
Right.
acknowledge it
True.
without harping
Yes,
on it.
that's
You
correct.
know? Yeah. Okay. So let's go into treating it, because we've already talked about how important it is to get early intervention. It's important for parents to not be afraid of dealing with it, talking about it, and then getting help. So what's the help?
Okay, so when we're dealing with preschools, our goal in therapy is eliminating stuttering. Is it always possible? No, but there's a high cure rate. The way to treat it today, we use one of two methods. One method is called the lithcom method. It comes out of Australia. And that's a behavioral approach, a sort of behavioral approach, where the parent is supposed to tell the child when they're fluent a positive feedback, something like, "Oh, that was nice talking." And then every once in a while, on a ratio of about 5-1, the parent's supposed to tell the child something about their stuttering. "Oh, that was a little bumpy speech." It sounds a little bit strange,
It also
but
sounds like what I just said not to do.
right, it sounds a little bit strange, but there's a lot of research that it actually works.
Like neural wiring, like you're reinforcing the good wires and not the bad.
We don't know why.
Oh,
We don't know
okay.
why, but
But it works. Okay.
It works. The data show that it works. So lithcom works. I really simplified the whole approach, but that's
Right.
basically the gist of it. It's a parent-centered approach. The therapist is supposed to teach the parent what to do in the home environment, and the parent implements it, charts it on a chart on a daily basis, and there's a lot of research that it actually does work. Okay, that's one way of working on it. The other way of working on it is what we call the demands and capacities model. So this thinking is that
Demand of capacity
demands and
and
capacities.
capacity.
So this way of thinking about it is that the child stutters because the demands on his motor and linguistic processes is just too much for him to handle. And you have to reduce the demands, and it should be on the same level as his capacity, and then the child will be fluent. Again, I'm simplifying it, but let me just give you an example. So let's say we know that a long sentence is more conducive to a stutter. If a child's going to give you a long sentence, he will more likely stutter than if he just tells you a few words. So part of the therapy might involve having the parent get the child to say fewer words at a time. I'm just giving you one example. So we're reducing the linguistic complexity in this case. So the demands and capacity model make a lot of sense, as opposed to the lithcom, where we say, how does it work? We don't know.
But
Okay,
it
the
works.
demands and capacity model makes a lot of sense. But the problem was, a few years, we didn't really have research that it worked. But recently, a few years ago, in the Netherlands, they came out with a study where they compared the lithcom and the demands and capacities, and it showed that they were virtually identical, about 75% efficacy.
Could you combine them?
Can you combine them? I guess theoretically you can, but no, it doesn't really work.
Interesting.
Because the approaches are very different from the way they think about stuttering. One is let's just take all the pressure off the child. We're not talking about stuttering at all. We're not bringing attention to his speech. We are just reducing the complexities and the demands on his system. And the other approach, lithcom, is, yeah, we can talk about disfluencies, no problem. Combining them is like, no, just putting two things together with the total opposites. I guess you can, but nobody does.
Right. It's so interesting to me because they both sound behavioral and you're telling me it's neurologic. So I just find it so fascinating.
They both sound behavioral?
To me, they both sound like a behavioral approach.
Well, demands and capacity is not a behavioral because we don't talk to the child at all about his stuttering. Not at all. There's not a single word to the child about his stuttering.
So how do you reduce the demands and capacities then?
Well, it depends. Again, if we're working on the linguistic component, we we tell the parents how to reduce their linguistic capacity. So the parent, let's say, shouldn't ask too many questions. The parents shouldn't talk too
Okay.
fast. If you talk too fast, the child will want to talk fast as well, and that will make him stutter. So it depends. Also, they're very into temperament and self-regulation. Some
Mhm.
kids who have reduced self-regulation, in other words, they can't really handle stress. So you try to make sure that they're not under a lot of duress. And when you do that, they stutter less. So again, we don't talk anything to the child about stuttering. We just reduce all this stuff that's around the child that we identify are problematic and make him stutter. We reduce all of that, and by itself, the child just starts being more fluent.
Interesting. I'm also surprised because I imagined that it would be a lot of sessions with a therapist, but it sounds like it's all parent driven.
Yes, but the therapist has to teach the parent. It sounds simplistic, but it's not. You have to identify what are the triggers here, and then we have to teach the parent how to actually implement them.
So what
And
does it
even
look
if you,
like? I'm sorry, what does it look like for a parent? Okay, I'm coming to you. How many sessions would it take?
oh, I can't say for sure how many
Mhm.
sessions it would take. It depends on how the severity, it
Mhm.
depends on how many issues are going on over here, and also depends on how quickly the parent picks up on it and how much they implement it. It's not so easy. I can't say for sure. But it's a lot of work in many cases because the parents have to totally shift the way they talk to the child.
Right. And they can't just give it over to the therapist and walk away.
No, if a parent expects the therapist to do it, then it's not going to happen. It has to be done in the home.
Now, what if it's an older child or an adult? What then?
Okay, so now once we go away from preschool, now we're already going into school age,
Mhm.
teenage, and adults. So now the goal of therapy isn't anymore eliminating stuttering. Right now, it's a whole different ballgame. So here we go into two different approaches, and they are totally opposite ends of the spectrum. So on the one hand, we have what we call fluency shaping. And fluency shaping is basically the idea is we're going to teach the person to speak fluently. It's purely a motor kind of a therapy. We teach what to do with our motor system to keep speaking fluently. On the other hand, the other part of the spectrum, other side of the spectrum is where what we call stuttering modification. In stuttering modification, we don't work on fluency per se. We just tell the person to basically accept that this is who he is and that he will stutter. And then we also try to give him certain tools that the stuttering shouldn't just go on and on and on and on and on. And the fact that the person accepts his stuttering reduces his anxieties.
Right.
And that in and of itself makes the person stutter less. So these are two total opposites. Most therapists today are somewhere in between.
Mhm.
And we call that the integrated approach. A little bit of this and a little bit of that. So as opposed to before in preschool, you asked me, can we combine them? And I said, not really. Here, most therapists actually do combine them. Very few today are either fluency shaping or stuttering modification. Personally, the way I work, I'm also part of the integrated approach, but I allow the person to tell me, what do you want me? What do
What
you
are
want
your
me to do?
goals?
What are your goals? And usually what happens is they change as therapy progresses. They change their mind. Usually people come in and say, well, I just want to speak fluently, strictly fluency shaping. But then when they realize how difficult it is and what's involved in constantly monitoring your speech, it's not easy. I mean, when we're talking, we're focusing on the content of our speech. So you're asking a person who stutters to not only focus on his content, but on the listener's content, what the person is saying, the other person is saying, and also on how he's saying it to monitor his lips and his tongue and all the other motor things involved. That's a little too much. And usually what happens is people will move towards the other side. Not everybody. Some people want to just speak fluently. But my personal bias is towards whatever you want. That's what I'll help you with.
It makes a lot of sense that people should really understand just how hard it is when you're an adult with this issue. And first of all, just underscores how important it is to get help early, because you can actually treat it more completely for young children. Am I correct?
Well, it depends. So let's say that after preschool, they're let's say like 7, 8 years old. So between 7 and 10, that's a notoriously difficult time to treat children.
I'm talking about the young. I'm talking about the preschool age.
Oh, the preschool age, yeah. Well, then, yeah.
Right. That's early intervention.
Because over there, the goal is eliminating therapy, and we have a 75% efficacy.
Right.
So for sure.
Right. But I saw on the website, they were saying that a parent had been told your child over 7, it's not curable. And I don't want to leave the impression that it's if you don't get it by a certain age, it's too late. But it's like you said, the goals start shifting.
Yes.
And that's important for people to understand. And it's also important for everybody to be empathic of how much work it is once you have a stutter that you haven't.
Correct.
fixed
So yeah. So
as a young child.
In preschool, the best thing is to get therapy, because that's the only time really that you can work towards eliminating it. And yeah, once they reach 7, 8, 9, they're very difficult to work with, because children at that age don't really realize yet the ramifications, the social ramifications, the academic and the vocational that's involved in stuttering. They don't get it yet. They haven't had so many negative emotions attached to it. They haven't talked to many people who made fun of them. They're living in a certain cocoon
Right.
where they have their friends, and their friends know them, and their friends accept them for who they are already. Generally, they may have a little bullying here and there, but they're not out there in the real world yet, where they have all this negative emotions. Once they reach like adolescence, then they realize what's going on and what it entails, and then they're really interested in therapy. 7, 8, 9 is really a difficult age to work with.
Right. So going back to the older kids, teens and adults who have the problem, let's go back to that. And let's talk about everybody else, how they can help and what they should and shouldn't say and do. Because I think that's important to be supportive.
Yes. So generally, I'm not talking about the parents. Just generally, when somebody meets somebody who stutters, well, you have to try not to finish their sentence. I know sometimes it's very hard. And even if you know for sure what the person wants to say, you're still not allowed to finish it, because that makes the person feel terrible about himself. So you don't interrupt him, even if you're not cutting him off. Just when we talk over each other. We should try not to do that with a person who stutters, because that makes them very nervous and they can stutter more. And also another thing, if possible, and this I know is very hard, but after the person finishes talking, the fluent speaker finishes talking, to wait a second. I'm sorry, after the stutterer finished talking, to wait a second before you respond. So not only shouldn't you talk over them, but when they finish talking, pause a second. That gives them the feeling, that gives the stutterer the feeling that, okay, this person is not in a rush. Right. If a person's not in a rush, then he's fine, and he'll feel less rushed and he'll stutter less. And of course, the other thing is, don't give him any ideas. Don't tell him, start again, think before you talk, take a deep breath. People who stutter know that. They've heard that many, many times, and they're not interested in hearing it again. So the idea is just deal with him like you do with anybody else. And the only thing is, give him a little extra time. For parents, I give a whole different thing. But that's already, much, much longer, much more in detail, what I tell parents.
And it really pays off in the end, because if you're talking on a regular basis to someone who stutters and you give them that space and that time, it'll be easier for them. It'll be easier for you, right?
Yes.
So it really pays off in just a practical way, not just a human, nice person kind of way. So what do you tell the parents in those situations?
Well, for parents of preschoolers, I give them a whole list of do's and don'ts. So I tell them to speak a little slower. I tell them also to pause after the child finishes talking, to pause a couple of seconds before they start talking. I tell them also that we spoke before, when the child has significant stuttering, to acknowledge the stuttering.
Mhm.
I tell them to set aside about 50 minutes a day, just one-to-one time. And I will also tell them not to interrupt them, even when they're fluent, and to try as much as possible, even though I know it's very difficult, to institute a rule at home that only one person is allowed to talk at a time. Because when several people talk at a time, it's very difficult for the stutterer to get the words out. And then the other ideas that I give them are along the same lines. It's basically to reduce the demands on the child and to make an environment where they feel they can talk without being judged.
Correct. That's really helpful. What about parents of older kids? Is it the same or is there something else? And what about supporting the child from being bullied?
Okay, so bullying. So bullying is a very big problem because parents seem to believe that if a child is bullied, they'll tell the parent. And we know from study that's not true.
Right.
About 60% of children who stutter report being bullied. And we know that most kids who are bullied do not tell their parents. So parents can't assume that the child is being bullied, that they're going to know about it. They probably will not. Bullying is dealt with in the therapy room, and there's a whole program for that. It's not something that I could just say in a podcast. It's a whole long thing, how to deal with the child. Basically, we work with the child to try to figure out what response works best for the bully.
Interesting.
Yeah.
You're kind of doing bully proofing. I'm going to just throw in something here, okay? Yes. This is not part of this podcast, but I can't help myself. Dr. Ronan Novick is a child psychologist who has created a phenomenal bullying program. And what she says is you have to change the culture of the school. You can't just work with the child or that family of that child who's being bullied. And you can't just have a 1-hour presentation or, yun or whatever on this. You have to create a school culture from the school bus to home, a whole pipeline of acceptance. And so if your child has this, I would advocate for something like that, to not just work on the child and, building up your child and strengthening them, but making a culture where that's not okay.
So, yeah, I used to give speeches to teachers, and I would talk about this a lot. I told them there has to be a zero tolerance.
Right.
But right now we were discussing what I tell the child.
Right.
So I just had to throw that in. No, you're right. In therapy, when I'm dealing with the child, what I say is, okay, so let's make a list of things that you think would work, and we try them out until we finally find what works. But we have to deal with bullying, yes.
Right.
I want to talk about something else. I want to talk about something that I find I have to deal with a lot, and that is that parents of, especially preschoolers, don't bring in the children for therapy, for an evaluation even. And I think it's based on two reasons. One is that parents are not even sure what stuttering looks like. Many times I hear a parent tell me, well, he only has a hard time when he starts. After that, when he starts talking, he's fine. Well, that's called a silent block. A silent block is when there's nothing. And the person just can't say anything. And then, once they start. Or they'll say, well, it's very mild. Well, so what if it's very mild? Mild is just a number again. Right. Doesn't mean how much is bothering him. And in the preschoolers, mild could still be stuttering.
Right. And so also when they're older, it may bother them more. And it's easier to fix when they're young. I mean, we can't emphasize that enough. We talked about that before, but we cannot emphasize enough that getting in there early makes all the difference.
But there's another reason, I think. And that's because it's based on a study that was done in the 30s by somebody, Wendell Johnson. And I'm not going to go into the whole study, but basically what he was trying to do was trying to figure out whether if we call attention to a person's normal disfluencies and we say, you're stuttering, will that increase his disfluencies? And he did a study. It was really unethical, but he did a study and it seemed to show that, you can actually make it worse. Now, today we know that the study was totally flawed, besides the fact that it wasn't ethical. It was totally flawed, and it's not true. But in those days, he came out with a paper, and he told parents that his study proves that you can actually make children stutter. Children who are normally disfluent, you can turn them into stutter. And since then, that's been going on and on and on, and still part of what people believe, that you can
Really?
actually make, you can actually make the child stutter. And
But-
it's totally not true.
Right. I mean, I'm thinking that it's just maybe more of a stigma, or since so many children do stutter, the belief that it'll just go away. I mean, as a pediatrician, I see this all the time. Parents don't always know what's normal and what's not, and just hope it goes away.
Well, yeah, many people say, well, most of the times it goes away. But yeah, but the answer to that is, well, most of the time, but this is your child. Do you really care if 99% of them have spontaneous recovery? That's not a good enough reason. No, I think because it's just people have known this Wendell Johnson study for years and years, and it's ingrained, and it's very hard to get people to believe that it's not true. It is totally not true. The study was totally flawed, and we know today that no, if somebody is normally fluent, then you can't really make them stutter.
Right. And it goes back to not being afraid to talk to your child about it. It's not going to make it worse. It's going to make it better.
Right. Yes. That's part of the whole thing. People didn't want to talk to them because they were afraid that it's going to make it worse. So
Right.
not only is it not true, but yeah, it helps to tell them and put their minds at ease, for sure.
Right. And back to timing, because you did mention that it's fine to wait a couple months. My understanding is that if stuttering goes on for 6 months, even if it's during the age when a lot of kids have this disfluency, that you should not wait any longer. That 6 months is as long as it should be lasting, and then that's
Yeah.
it.
I would say even after 3 months, if the parents is concerned to reach out to a therapist, but certainly after 6 months, yes.
Right. Or there's red flags. Like I said, I've referred patients where the father stuttered and said, I stuttered, it's in my family. Boom, you're going. I don't care, your child's 3, and other kids are also having that similar.
And I would say, even if the parents say, well, it's only mild or only sometimes, well, so what? Stuttering varies.
Right. Yes.
People who stutter don't stutter all the time.
Right. Right.
And that's what's sometimes very confounding to people. How
Right.
could it be that he wasn't stuttering and now all of a sudden he is? Well, that's just the nature of the beast. Sometimes they stutter, sometimes they don't. Sometimes we know what triggers it, and sometimes we don't even know what triggers it.
But can you imagine in your mind thinking, okay, well, this way, if I say this way, I won't. So then you keep saying, I'm not going to do this because this makes me stutter. I'm not going to do this and this and this and this. How much disability there is.
Right.
So
So,
the anxiety and the avoidance.
well, so now we could go into something what we call a covert stutterer.
Mhm.
So there are people who hide their stuttering to the point where nobody knows. Sometimes even their spouses. They use all kinds of avoidance behaviors, word substitutions, circumlocutions. They won't go to certain events. They'll do coughing, all kinds of tricks. Nobody will think that they stutter. They really hiding it well. And we call them covert stutterers. Some people might ask, well, how is that any different from treating them like fluency shaping, where the person doesn't stutter? Well, it's very different, because at least in fluency shaping, we're telling the person, you can say whatever you want. You can talk to whoever you want. Go to any event. Just use these tools. Now, again, it's questionable. Is it realistic to use those tools in every situation? But at least the person is told, you can talk to anybody. Just be yourself. Just watch your speech. As opposed to a covert stutterer who doesn't do any of that. They are very, very focused on being fluent, and they'll do anything. So they'll scan ahead when they're talking to make sure that there's no word that's coming up that may make them stutter. And they're always anxious. Usually they will not come to therapy, but sometimes they'll come in because they'll say, I can't handle this charade anymore.
Weird.
Right. It takes a toll on their mental well-being. But sadly, even after they come sometimes to therapy, they don't want the therapy because the thought of actually stuttering openly is just too much for them.
Right. It's almost
Some
a
people
phobia.
do.
It's like a
Some
phobia.
people do.
Right.
Yeah.
But that's why, again, you don't want to make it, as a parent of a young child who has a stutter, you don't want to make it a bigger deal than it is. Like the way you approach it, if you can't talk about it, you're telling the kids, this is horrible, we can't even talk about it.
Right, absolutely. We want the parents to be open with the child. The child should feel comfortable talking about it and knowing that, okay, if he stutters, he can still be anybody. I mean, President Biden stutters, by the way.
Yes. Oh,
Yeah.
there's a whole list. We're going to get to those websites, and they have
Okay.
lists. Every website has
So
lists.
you can be anybody, anything you want.
Yeah.
And so you stutter a little bit. It's not the end of the world.
Right. So it's demystifying. It's calling out the elephant in the room and then demystifying it.
Yes. So when we work on the stuttering modification, or even those who work with integrated approach, there's a lot of desensitizing that goes on. I'll usually have people make phone calls. And if they stutter, well, okay, let them see what happens. I'll tell them, let's see what's going to happen. Will the person hang up? And you want to know something? Once in a while, they actually do.
It's fine.
But then they realize, now, wait a second, in 90% of the time, they don't. So wait, it's not so bad. And somebody who stutters and has been hiding it for a long time, it's an eye opener. It's like, wow, I don't really have to hide this stuff. It's really not that bad.
Right, because a lot of it's anticipatory anxiety.
Right, yeah, and anxiety makes it worse. Anxiety makes the stuttering worse. Once you bring the anxiety down, you make them accept the stuttering, even a little bit. It brings down the anxiety level and brings down the stuttering level.
Right, which is again how everybody can help, whether you're a parent or whether you're someone in the community. Just let it go, let it be.
Right.
In that space.
Please don't tell them start over, think before you talk, or any of that. People who stutter hate when people tell them that, because they've heard it many, 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 many times. And if it were that simple, well, he'd be doing it.
Right.
It's not that simple.
Right, right. I'm thinking about how I interviewed an audiologist, and she said that she tracks people's cognitive ability while she deals with their hearing loss, because she said people with hearing loss who have progressive hearing loss also become progressively cognitively impaired because they're using a lot of their cognitive ability to hear better. So I can imagine it's the same thing for a stutterer who's using so much of their cognitive ability to not stutter.
Well, yeah, people who stutter and who are watching themselves because they don't want to stutter, they use all the avoidance behavior. Yes, they're using a lot of mental effort to avoid stuttering. And so when they're told that, hey, you know what, you're allowed to stutter a little bit, then they can focus more on the conversation. And then they realize, wait a second, you know something? I wasn't even stuttering that much. But to go from point A to point B is a lot of work.
Right, right.
And
this is why we're not going to get into it, but there's a whole movement now, sort of a stutterer's identity, thing where I'm a stutterer and it's okay. And I'm not even going to change it, So right. Just one end of the.
There are people like that. It's not for everybody, but there are people like that. Yes.
Right. But I think acceptance is very helpful to reduce that anxiety.
Well, acceptance is for everybody.
Yes. Yes.
The question is the degree of acceptance. Yeah.
Right.
Sure.
Right. So I think we talked about pretty much everything that we wanted to, except you did want to mention the difference between using a regular speech therapist and a fluency specialist, but I'm going to point out the obvious that there's not that many of you.
Right. That's true. So, but let's first talk about that, and then we'll talk about the problem that there aren't that many of us.
Okay.
Right? So, when people go to school to learn to be a speech language pathologist, we got to take a lot of courses. And the fluency course, again, which includes a stuttering, is today actually an elective in many schools. In many schools, it's an elective. To become a speech therapist today, you don't have to take a single fluency course. Okay. Most schools do have one class of fluency. Many times it's lumped together with voice disorders. But some schools don't even have one class. Okay, it's an elective. But even those that do get into a school that gives a fluency course, very few students actually work with people who stutter. So it's one thing to read about it and hear about it from a professor, but it's a totally different thing to actually work with somebody who stuttered. And it used to be when I was going to school that we needed X amount of hours working with fluency in order to graduate. Not anymore. ASHA did away with that because it was so difficult to find those hours. So it is very, very possible to go through school to become a speech therapist and not have any experience working with somebody who stutters.
I don't get that. That's backtracking. That makes no sense.
That makes no sense, but it's totally legal. That's why they made the specialty recognition. Oh, and you asked what's BCS-F stand for.
Yes,
It just
thank
means
you.
Board Certified Specialist in Fluency. So they made a fluency board where you have to be mentored by a fluency specialist. The mentor has to watch how you actually do therapy with diagnosis and treatment with various methods, with different age groups, preschool, school age, adults. The mentor works along with the person. And once the mentor feels that the person is qualified, then you have to send it into the board, and the board reviews it. And only then, if the board feels that you're qualified, they will give you the board certification. So it's a very lengthy and difficult process. I mean, had I known how difficult it would be, I probably would not have done it. I only realized when I was midway how difficult it was. At that point, I wasn't going to backtrack anymore.
Right.
So going to somebody who's a generalist is a hit or miss, because a person may know about stuttering, may not, may use one method which may work with that person, and it may not. The problem with using somebody who's a generalist and doesn't really know much about stuttering is that if it doesn't work, then the person who stutters feels very bad about themselves.
Right.
It's a very big letdown. People tell them, well, you probably weren't working hard enough. And then they don't feel like even going to a specialist. They say, I've been there, I've done that.
Right. Right.
Now, there is a problem that there are very few specialists. That's true. But there are some therapists who aren't specialists who are very good with treating fluency. They're also very few and far between, and you have to do your research to find out who they are, obviously. But it's a trade-off, obviously, going to somebody who's a generalist as opposed to a specialist if you don't have a specialist. Because if you go to a generalist, it may do more harm than good.
Right, right.
But
I'm thinking that now that there's telehealth, because this is something I can see working really well on telehealth, that you could access somebody that wouldn't be in your geographic location. No?
Well, telehealth is a good question. So let's do it as I say. When we're dealing with preschoolers, no, it's not an option. Absolutely not an option. When you're dealing with school age and older, yeah, some people feel that it's doable and they will do it. Ideally, I would rather not do it because it's just not the same. I like to actually see the person here. I want to see what they're doing, especially secondary behaviors. I can't always see it when I'm watching on Zoom.
Right, but what about if you're talking about helping the parents? You can talk to the parents on Zoom.
Oh yeah, that for sure we can do. Yeah.
I'm just throwing out options because I hate talking about awareness, and then you're like, okay, great, now I have nobody to go to. Now that I understand.
No, well, that's a problem that I've been dealing with. So yeah, right now I even have a preschooler that I'm doing by Zoom. It's very difficult.
Right.
But they can't come in. They live in a whole different city, so we have to do it. But ideally, it's not the same as doing it in person. But it's an option. If there's no other option, then it's an option. Yes.
Right. And I was going to say that speech therapists who listen to this can learn to get certified, but you just mentioned how many hoops you have to jump through.
Oh, it's very difficult.
I don't know why they make it so hard.
Well, I do, because you basically don't learn much about fluency in school. So it's basically starting from scratch. And then you have to learn about diagnosis, which is very difficult. Differential diagnosis. What constitutes real stuttering? What's normal disfluency? When to recommend, when not to recommend. Not everybody deserves to get therapy right away the first time.
Needs to, right.
Needs. Because they're not ready. Not everybody needs therapy right away because they're not ready. So you have to decide. And then there's different kinds of treatment methods. Obviously, you have different methods with preschoolers as you have with school age. So there's a lot to learn between diagnosis and treatment. There's a lot to learn. So it's very difficult.
I still think that there can be more education available to just basic speech therapists, even to know when to refer to a more greater specialist, and to find an easier path somewhere between the way it is now and nothing. I think it's perfect be the enemy of the good here.
I wish there were a better solution, though. There,
right?
But it is what it is.
Yeah, it is what it is. So let's give people some resources. I have them listed. Do you want me to give them or do you want to give them?
No, you can give them and I'll tell you if I have anything to add.
Okay, sure. So there's the stutteringhomepage.com, which has a lot of information. There's the National Stuttering Association, and the website is www.westutter.org. And that's a self-help organization. And I'm a really big believer in self-help and advocacy. And that would be a way that, say you have a therapist and it's not helping and you say, hey, I learned that this is making it worse. You can go to these websites and get help. Also, as an adult or an older, teen, you can get support. I'm a big believer in that. And it's also, the westutter.org is also good for speech and language pathologists to learn more, which I think is important. There's the Stuttering Foundation, stutteringhelp.org. And then you mentioned the American Board of Fluency and Fluency Disorders, which is stutteringspecialist.org. I think that would be really, really important if you were trying to get a therapist that actually has that training.
Yeah, and then there are also support groups that some people may or may not want to, but I'm a big believer in support groups.
Me too, yeah.
One of them I think is called SAY, S-A-Y. I think that's for the young adults, but one of those SFA and the NSA also have support groups. So that's a good idea, but you basically got those websites.
Right. And support for older kids and adults is really important because it also helps you feel more normal when you're meeting other people in the same boat.
Absolutely. It makes them feel amazing.
Yeah.
I usually attend, the NSA makes a conference every year. I usually try to attend every couple of years, and I observe people who started talking to each other. It's amazing how they just talk openly, they stutter openly. The camaraderie is amazing.
Right. They don't have to try to hide it or get around it or fight it.
And they feel great after the conference.
Right.
It's amazing.
Right. How can we find you?
Well, I work in Ezra.
Okay.
So that's one way, or they can email me. My email is mgrunwald@gmail.
Amazing. So I want to thank you so much for doing this with me.
My pleasure. There was a lot to talk about, and I hope we didn't leave out anything important.
I think we got a lot of information and a lot of good resources for people. So and a lot of awareness. There's a lot of things I didn't know. So yeah. I really appreciate this.
I appreciate that you gave me the time because there's really a lack of awareness out there.
Yes.
So I think that people can really use this. Parents of people who stutter, and even the medical community. Yes.
Right. Right. And there is hope at whatever age. There's no point when there's no hope, but pick it up early and treat it early.
There's always hope. Yes. But the earlier you treat it, the better.
100%. Thank you so much and good Shabbos.
Thank you very much.
And Chodesh Tov. Yes.
Thank you.
You too. You will.
Bye-bye.